guys know, we are presenting OCD and other related disorders. I'm in charge of excoriation, which is skin picking disorder, and body dysmorphia disorder. And I'm going to start off with excoriation. So excoriation is defined as skin picking, which is characterized by the repetitive and compulsive picking of the skin, which results in damage and infections and scarring and physical disfigurement. So some of the symptoms are repeated attempts to stop the behavior. It causes you clinically significant distress, and it impairs work and social life. So as like we were talking about earlier in class with Ms. Noland, you have to fit these characteristics and these symptoms in order to be classified. So someone might say, for example, oh, I feel so anxious, so I have anxiety. That's not the same thing. You just feel anxious, you don't necessarily have So you have to fit all these. So some examples of the first symptom is you seek therapy, you're seeking to stop, whether it's with a professional or you're trying to figure out your own way of stopping. For the second one, it makes you unhappy enough that it's starting to affect your life. And in terms of affecting your life, it can quit your job, or you might not go out in public anymore or hang out with friends. And yes, so that is it for symptoms and examples. Next we have the causes, which are, we'll start off with evolutionary. So the first one, it's said to be maybe a form of pathological grooming, which is similar to how monkeys might pick the skin or bugs off of each other or themselves. So aka, it's an evolutionary reaction. It may be the result of excessive degrees of normal adaptive behavior, which means that this is a normal behavior, you might pick at your skin just a little bit, but this is an excessive degree. Or the distortion of adaptive behaviors by some pathological process. So once again, it could have evolved from a normal evolutionary reaction, yes, and it might have manifested due to your OCD. So biological neuroscience, as we said earlier in the presentation, if your first degree family, your parents, have some form of OCD, then you're way more likely to have it. Let's see next. All right, so for treatments, we have SSRIs, which is from the neuroscience perspective. We have cognitive behavioral therapy, which we've discussed in class, but a new concept is humanistic therapy, and this one is called acceptance and behavioral therapy, and it focuses on 3 areas. You're accepting your reactions, and you're choosing a value direction, and then you are taking action. So that does fit into the whole humanistic perspective that we've learned in class. Next, we have breakthroughs. So they're thinking of using an overdose drug because it regulates our dopamine pathways, and they're also thinking of using the anti-seizure medication as well. And for future, an article suggested that we might treat the disorder as an addiction. So similar to as pathological gambling. So it's an impulse control issue versus a disorder, and they say that looking at it from that perspective might help bring about new ways of treatment. Next, we have body dysmorphic disorder. So this is an excessive preoccupation with a non-existent or very minimal physical defect. All right, so some symptoms are extreme preoccupation with a perceived flaw. Keyword here is perceived, so the flaw that you're looking at might not even exist. You seek frequent cosmetic procedures with little satisfaction. So some people get a nose job and they feel like their life has changed, and they're in love with the results, but in this case, you still are not satisfied with your procedures. And it may also include skin picking, which was another grooming that we just talked about. So an example, you might stand in the mirror for hours, or you might constantly fix your appearance and stuff like that. Next, we have causes. So from the neuroscience perspective, it said that there may be an abnormality in brain structure or neurochemistry, which is similar to all the other disorders, whether it's you don't have enough serotonin or dopamine or anything of those neurotransmitters. For cognitive, it's saying that your mind may not process your features correctly. So when you're looking in a mirror, when you look anywhere, your mind processes what you're seeing, all the visual information that's coming, and like it produces like an image for you, and it's saying that your mind is not processing it correctly, so the image that you're seeing is not reality. And psychoanalytic, this perspective usually deals a lot with childhood, and it's suggesting that there could have been childhood neglect or abuse. So for treatments, neuroscience, typically this SSRI and selective serotonin reuptake inhibitors. So from the humanistic perspective, it's using unconditional positive regard. So as we talked about earlier in class, unconditional positive regard is it's like the unconditional love that you receive from those around you. So it's saying using that to modify intrusive thoughts of body dissatisfaction and overall valued beliefs about physical appearance. And this suggested that you use unconditional positive regard on yourself, so accepting yourself no matter what, which is a very humanistic perspective to take. In behavioral, it's exposure therapy, which is what we just finished talking about in class, involving systematic desensitization in which the client is exposed to avoided body image situations. So like it could simply be just going out in public, or just going to work, or getting ready to go out. Before you don't even go out, you just get ready. So that's like something that we talked about in terms of systematic desensitization. And also using counter conditioning to eliminate body checking. So as we said earlier, you're constantly checking yourself in the mirror, constantly fixing. So using counter conditioning, which we also just finished talking about in class, to help remediate that. So for breakthroughs, this was personally one of my favorite parts of the project to learn about. So there is a visual training program to remediate a specific abnormality in visual perception. So this is from more of the cognitive perspective. So your mind is not producing a realistic image. So they were talking about using this program to help make it become closer to reality. And for the future, they suggested using longitudinal studies, which we studied earlier in the year, like we learned the definition of and all that stuff. So using those kinds of studies to assess whether executive functioning deficits may predict later BDD cases. So again, like that's more of a cognitive perspective, since it's talking about like executive functioning, which is AKA like prefrontal cortex thinking. And that's it.